Welcome to Classic Pilates with me, Sam, and thank you for joining me for this Pilates for Sciatica routine. I'm going to take you through some gentle stretches to help relieve any sciatic pain. So this is related to the sciatic nerve. It often stems from any issues that you have with your discs or spinal issues, putting pressure and pressing against the sciatic nerve. And this you can feel from the lower back to the top of your glutes, down along the back of your thigh. It's also relatively common in pregnant ladies, especially in the third trimester, because as baby grows and gets bigger and heavier, put a lot of weight on the lower back, you'll go into a bit of a lordosis in the lower spine, and sometimes you can suffer from this too. So these are pregnancy safe stretches. I will say one thing, we are going to be lying on our backs for the first few moves. All you're going to do is take two sort of big continental pillows and prop yourself up so that you're lying on your back at a slight angle. But if you're still early on in pregnancy and you feel fine to lie on your back, we're not there for long, so you can do so. We will start lying down. Knees bent, feet hip distance apart, arms by the sides, and you're going to drop your shoulders open. We're going to bring the knees in one at a time with your hands on top of the knees, and then we're going to imprint the lower back as you tuck them in and then open the knees to the sides, keep the toes touching, and then pull them back together. So you breathe in to tuck in, exhale to circle. So it's a little movement for the lower back as well as rotation in the hips. Think of stirring with the legs. Another 3. 1. Bring the legs together. Now we reverse direction. You open, pull the knees towards you and together, and then press away. Breathing in. Breathing out. So my spine is in neutral. And then I imprint the lower back to turn in. Another 3. Last one. Breathing in. Breathing out. Then place your feet down, hip distance apart, arms by the sides. We're going to do a little hip release. We start with the right leg first. You drop the knee out to the side. Watch that there's no movement in this left leg. Straighten. Turn the foot inwards, slide back up. Same leg. So you open the knee, keeping still in the pelvis. Straighten. Pull back up. The breathing is inhale. And exhale, you're contracting the abs to pull the leg back in. Another 2. Lovely hip release. And 1. Now you're going to straighten the left leg away, bend in the right knee, and we angle the knee to the side as if you're drawing it towards the armpit. And we hold there for 3 deep breaths. Breathing in through the nose, out through the mouth. 1 more. Now we're going to slide the left leg in, place your right foot at the top of the thigh. This is a figure of 4 stretch, so push that thigh away. If this is already a deep stretch and you're feeling it here around the hips, you can stay here. If you're not feeling anything, you grab a hold of the back of your left thigh and pull in close. You can also push the right knee away, drop the shoulders down, relax them, and we stay there. 3 deep breaths. In through the nose, releasing out through the mouth. 1 more. Let's place that left foot down, and now we bring the right foot against the inner thigh, arms open to the sides, shoulder blades pinned down. We're going to do a little release for lower back. You're going to press with your right foot, the legs go to the left, and then push with your left knee, the legs swing to the right. Breathing in to the left. Exhale to the right. Three more here. Feel a lovely little rotation in the lower back. And one more. Breathe in. Exhale back to the center. Then we're going to place your right foot down and you're going to bring your hands to your hips just to make sure they stay nice and stable as we open the left knee to the side without moving the right leg. Glide the foot along, turn it in, pull back up. It seems very simple, but it can be quite tricky to keep this right leg as still as possible. Open the knee, slide, turn inwards. So I'm sure you've noticed by now that lateral rotation, turning outwards from the center of the body, is what we're looking for when trying to ease sciatic nerve pain. Last one, breathe in, open, slide down and back up. Now tuck the knee in towards the left armpit as you straighten the right leg away. So you're angling the knee slightly to the left. Hold it in. You can do a nice little tuck and imprint of that lower back. 3 deep breaths. Remember to relax your shoulders. One more deep inhale. And exhale. Slide your right knee into bent position. Left foot goes on top. Push it away. Remember, if this is enough, stay here. If you want to deepen it, pull it in. So now you may, and hopefully you only have your sciatic pain on one side, but we all notice we're obviously doing both because I don't want to leave you skew, and it's good to stretch and breathe all the same. One more deep breath in there. Pull the leg in close, push the left knee away. And let's put the right foot down, taking left foot onto the inside of that thigh, open the arms. Shoulder blades are flush with the mat. We push the legs, swing over to the right. And then without moving the shoulder blades or lifting them, the legs swing over to the left. So focus on your right foot here. You're rolling onto the outside of the right foot. And then you're rolling onto the inside of that foot. A little ankle movement as well. Inhale. Exhale across. 2 more here, breathing in. Last one, inhale across to the right. Exhale to the left. Coming into center, you're going to hold the back of your thigh. You're going to use it to help lift you up. Now we do a sort of figure 4 stretch in a seated position. We straighten the left leg away, flex the foot, take the right foot across, and you're going to slide it up as high as you're able to. Obviously, if you're pregnant in your 3rd trimester, it's not going to come up very far because baby's in the way. So just go where you can or open the knee to the side. So sliding in, you're going to hug this leg in with the opposite arm. So if it's right knee, left arm holds, right hand behind the back, look over the shoulder. Hold this here, growing tall. Try not to lean the weight into your arm. Feel the weight through your sit bones. Two more deep breaths there. And let's change sides. Straighten out the right leg. Left foot slides up. Hug it in with the right arm and then bring the left arm lightly behind you. The weight of the body is in the sit bones and up along the spine. Look over the shoulder. Feel the whole back stretching here. Front foot is flexed. Two more breaths. And then let's untwist back to center. We're going to straighten the legs out. You bring them together. Turn onto your side. Bend your bottom knee in. And you're lying all the way down. So your top foot is in line with your shoulder, abs are hugged up, and your hand is in front here just for some light support. We're going to flex the foot, kick forwards twice, 1, 2, and point backwards once. So it's 2 kicks to the front, 1 glide back. Watch this top shoulder doesn't move. You want to stay still in the upper body as you press the leg behind especially. So the breathing is 2 inhales with the 2 kicks, 1 exhale as you press behind. Breathing in, breathing out. Inhale. The leg comes forwards with the flex foot. You're getting a stretch at the back of the leg, and it goes behind. You're stretching at the hip flexor. So really try and get the foot beyond the hip, not just in line with it. 2 more. 1, breathing in, breathing out. Fold it in, push yourself up, and let's swap sides. So swinging the legs around. Bottom knee bent, top leg is straight. Bring the leg up, abs are drawn in to help you find balance, and the bottom knee is bent to the front. 2 kicks. 1 push back. Flex the foot as it goes forwards, point as it goes behind. Breathing in, exhaling. Four more. It's as if your leg is gliding on the same level surface. 2. And 1. Fold it in, and then pushing yourself up, we're going to go into hands and knees now. Shift your hands over to the left side of your mat so you can make space to bring your right leg forwards. Use your hands if you need to. And then walk that foot out. We don't want the foot to be directly below the knee when we start. The knee is below the hip. Now we're going to flex the foot, straight the leg as much as you can. So we're now stretching hamstrings to take a bit of pressure off the sciatic as well. And then bend the knee, walk your hands forwards and drop that left hip down. Walking back. Breathe in, hold. Exhale, walking forwards, drop the hip down. Breath in. Breath out to walk back. Staying here. Gliding forwards. Let's do another 2. Walking back. Hold. Obviously, any knee pain, you roll up a little towel, tuck it underneath your left knee, or you don't have to make these such big ranges of motion. You can always just hold here and bend back to this position. So you do what feels fine for your knees. And 1. Now come up to start position. We're going to tuck the toes, that back foot under. Same move. We're just going to do it lifted. Flex the front foot, try and straighten the leg. Don't worry if it won't straighten if you have tight hamstrings. And then dip the hips down. Yeah, you might need to wiggle that foot back a bit. Straighten the front leg, flex the foot. Inhale to dip down. This is not possible for you. Keep the knee down and continue with the first move. Flex. We change the breathings now. Inhale and exhale. 2 more. 1. Gently bring that knee all the way down. Walk your hands to the left. Zigzag the foot. Swing it behind. Hands to the right so you can make space to get the left leg forwards. Make sure that the foot is not below the knee. We start with the fingertips down. We straighten as much as we can. Flex the foot. And then dip down. Press back. Hold for the inhale. Exhale forwards. If your fingertips get sore, you can always come up onto your knuckles or go onto flat palms. Walking back, flex, pause. Walking forwards, dropping the hips down. Hold. coming forwards. Now, if you're able to progress this move with the knee lifted at the back, straight in the front leg, you might need to take that foot a bit further behind, then drop the hips down. Inhale, flex, exhale, point. 4 more, breathing in, breathing out. 2, last 1. Gently bring the knee all the way down, hands to your right, walk the foot out, swing it behind, and that is it. You are done. I hope you feel a little bit loosened up around that sciatic nerve and that you have found a bit of pain relief. And thank you so much for taking this time to do this workout and get on your mat with me.